Hello, my name is Aramandla Ramesh. I am an associate professor with the National Center for Medical Education Development and Research at Meharry Medical College. This center is funded by HRSA and headed by Dr. Paul Juarez and Dr. Patricia Matthews-Juarez. One of the goals of this center is to address the health issues of vulnerable populations, which includes people belonging to the LGBTQ category, people experiencing homelessness, migrant farm workers. And what we would like to see is the educational interventions that are in place to treat the vulnerable populations, and also conduct a systematic review of the literature to find out what are the methods that are currently being followed and what else need to be done to treat vulnerable populations, and how could we incorporate all the information that we gained from the systematic reviews, curriculum modules, or policy briefs into improving primary care training and practice. One of the topics that we are interested in is to look into affirming and inclusive care training for medical students and residents. And as you may know, gender and sexual minorities, especially people belonging to the lesbian, bisexual, gay, transgender, and queer categories, they experience a lot of disparities. They suffer from a wide range of physical and mental health disorders. And the Association of American Medical Colleges also advocated for increasing efforts to effectively treat the gender and the sexual minorities. There are several barriers to treating these people. One is the implicit bias and the attitudes of the care providers, the lack of knowledge, lack of empathy, and lack of comprehension about the health issues of these populations. So in order to provide guidance to medical schools to increase their content regarding this special category of populations and the associated health disparities, we have conducted a systematic review of the literature using PRISMA guidelines. Our whole idea is to identify original studies that focused on medical school training to increase knowledge, comfort, as well as improve the attitudes and the skills of both the medical students and residents in working with the gender and sexual minorities. So, as I said earlier, as part of the systematic review, we have conducted a thorough review of the literature using 9 databases, which includes PubMed, Medet Portal, Google Scholar, Web of Science, Scopus, Ovid, and then ERIC, PsycInfo, all these databases. And we have screened more than 20,000 articles. And all the articles were subjected to a set of inclusion and exclusion criteria. Inclusion criteria are those that the studies must be published in English, studies must be conducted in the United States, and the studies should have used both qualitative, quantitative approaches, and the studies also employed various pre- and post-test measures, and whether they really used educational interventions. And after all the screenings are done, finally we came up with a list of 44 articles that focused on providing care for the sexual and gender minorities. And what we found out was there were some articles, a great majority of them 26 of the studies, 25 to 26 reported significant increases in knowledge of both the students and the residents. And when we screen the articles against the student satisfaction, only 6 articles assessed satisfaction. And when we focused on attitudes and beliefs, only 6 of the 8 articles reported improved attitudes or belief changes. And some of the articles reported students could retain the knowledge only up to 90 days post-training. And in regard to the comfort, only 4 articles measured comfort in working with gender and sexual minorities. And 12 of the articles reported increased confidence in treating patients. And some of the studies reported improved skill, and the measures reported varied. Some used standardized patients, and some used simulated patients. If you see these findings, what is found is, even though the knowledge base is increased, not many of the studies were able to test the comfort of the care providers in dealing with patients. And again, confidence. After getting all the educational interventions, are they confident enough? Not only the competence, but also confidence is key. Are they confident enough to diagnose the health issues of these populations and come up with remedial measures or interventions? So all these findings show that there is still a large gap in providing care to sexual and gender minorities, and more efforts need to be executed to provide additional training. And also training is necessary to tie what is learned in the classroom is translated into clinical settings. Certainly there is a scope for more work need to be done in this area. Thank you.